The World Health Organization has flagged this fifth Indian drug in 10 months. Now, the government's carried out inspections, licenses have been taken away, etc. But is this enough to fix the problem?
Well, I mean, if the actions of the government were to fix the problem, we wouldn't have seen a fifth incident, have we? Clearly, this has been a long-standing issue, right? If you recall, the first incident in Gambia happened in late September of last year. We are in the middle of summer right now. We're in August of 2023. It's been a good 9-10 months. So if you're saying that the government has taken some action to try and rectify this, why do we continue to see these incidents happen over and over again? I mean, we've seen Gambia, we've seen Uzbekistan, we've seen Cameroon, we've seen the Micronesia and Marshall Islands, now Iraq. Why do we continue to see this happen? What does it say about the government's ability to control this?
In your book, Truth Pill, The Myth of Drug Regulation in India, you've argued how the regulatory regime has favoured industry at the expense of people. Explain as simply as possible to our viewers tonight the major pitfalls with the Indian drug regulation currently.
It's a long-standing problem. The governing regulation in India for our medicines is a pre-independence regulation. It's called the Drugs and Cosmetics Act. That was passed by the Council of the States in India before we became independent in 1940. And over a period of the last 75 years, we've been patching it. Essentially wherever there's a problem, we've been trying to put band-aids. And our focus has largely been, the advancement of the industry rather than, protecting public health of the people. I mean, in 2019, we had 11 children die in Jammu, followed by another child, in 8 months later. Very little was reported of that because, the ability of the local press and the national press to report on these issues is obviously not there. But you can't control these things when they happen in Gambia. You can't control these things when they happen in Uzbekistan or Cameroon. So the point I'm trying to make to you is that the regulation and the regulator that's responsible for making sure that we have good quality drugs, they just basically don't work. And that's the reason why you continue to see this. I mean, I'll just give you a very simple example. Have you read the CAG report that was recently released in 2022? This is report number 17 of the Controller and Auditor General of India. And this talks about the quality of medicines that is dispensed in the central government health scheme. You know who the beneficiaries of the central government health scheme are. Indian Army, retired bureaucrats. Many people who essentially enroll in the central government health scheme. This report talks about the fact that in Mumbai, 26 lakhs of bad quality drugs were dispensed to patients. And in Hyderabad, 24 lakhs. In Nagpur, 2.6 lakhs. Where was the discussion that the people who are beneficiaries of the central government health scheme are actually getting bad quality drugs? Have you read about the recall of these drugs? Have patients been informed that if you're taking blood pressure medication, if you're taking medication to control your diabetes, have they been informed that over a period of time you're taking drugs that actually could be ineffective or worse?
You've raised several important points. Then centralization of drug regulation, will that be the solution? Because right now, from what we understand, from what you're saying, every state appears to be just doing its own thing.
Yeah, so the drug regulatory framework in India actually is very fragmented. So if a manufacturer in Himachal or Uttarakhand makes a bad quality drug, and the drug is actually tested and found to be not of standard quality in Tamil Nadu, there is precious little that the drug controller in Tamil Nadu can actually do about it, because they don't have the ability to penalize the manufacturing facility that's located in Himachal, right? All they can do is write a letter to the Himachal drug controller saying, hey, you know what, we found a batch of drugs that are manufactured by a manufacturing facility within your remit, and these are not of good quality. And the one in the drug controller in Himachal basically will get the letter and throw it away, because it's not in their financial interest to try and do anything about it. And the Central Drug Control Standards Organization, or national regulator, is important because it doesn't have the powers to be able to do anything about it. I mean, the least of all, we don't even have a law requiring recall when we know fully well that there are bad quality drugs being dispensed as a part of the national central government health scheme.
Right. Okay. Speaking of the new law, this new Jan Vishwas bill that has been passed in Parliament, essentially, many argue that it's going to further dilute punitive action against pharma. Now, the government has clarified that this would apply only to a certain section 27D, which is not of standard quality drugs and misbranded drugs. Do you agree with the government justification?
First of all, this notion of not of standard quality drugs are not a big problem. Even government's own data actually disputes that. Government's own data, the CDSU survey data says that the biggest problem we have in our country is drugs are not of standard quality. And, they basically poo-poo that, basically saying that's not a problem for us. That's absolutely not true. Second, let me just give you a couple of examples of the kind of stuff that falls within what they call minor issues, right? At the peak of COVID in Bihar, we had deaths in people because they were administered injections of remdesivir that were contaminated with bacterial infection. The drug wasn't tested for endotoxin. There was it's a big investigation done by the Mint. There's a long report written about it as well. Those kind of things the government says are minor issues. If people die, it's a minor issue. And they're saying that the minor issue can then be compounded. The law, Section 27D of the Drugs and Cosmetics Act basically says that in the past, there was a deterrent in the law that said that if in a court of law, it's proven that you have, caused bodily harm to people with your product, you were liable to be punished with a prison sentence of 1 to 2 years. It was in the old law. What the government did in 27D with the new Jan Vishwas bill that has been just passed by both houses of parliament is they've removed that deterrent. They basically said that now if you pay a monetary fine, you can just basically go home. The judge doesn't even have to justify why, if the product that you make that causes bodily harm to somebody, that they're not even be held punitively accountable. And that, I think, is a terrible thing for our drug supply.